My name is Dr. Frank Vicini. I'm a radiation oncologist working for PrecisCa. I predominantly treat breast cancer in the United States. Been involved in research and protocols for about 25, 30 years now. Well, breath hold is used predominantly in left-sided breast cancer patients to reduce the heart dose. In other words, as radiation techniques have improved through the years, one of the things we've tried to do is to lower the radiation exposure to the heart as much as possible, such that there are no concerns any longer for long-term toxicities. So in those patients where when we're treating the whole breast or the chest wall after mastectomy, where we do our CT planning and we see that the heart is too close to the chest wall, one of the techniques that we can do is called breath hold. That is, a patient takes a deep breath. And when they do that, the chest wall and the breast move away from the heart, allowing us to time the radiation therapy to be delivered when a patient takes a deep breath and the heart moves away from the chest wall. It's pretty much that simple. And we turn on the beam when the heart is away from the chest wall. And the patient has to only hold their breath anywhere from 10 to 15 seconds. So it's not very difficult for the patients. But nonetheless, there are various ways that we can assist a patient to hold their breath. One of the things that I was involved in developing and that is used quite frequently in this country is called ABC, assisted breathing control. It's an apparatus that patient has a mouthpiece and allows them to it assists them in holding their breath such that on deep inspiration, the heart is moved away from the chest wall again, and turning on the linear accelerator, the radiation beam is timed to when they hold their breath. And this typically takes about 4 to 5 different breath holds, depending upon obviously the clinical situation, the size of the breast, etc. But nonetheless, there are also other ways that we can assist the patient in holding their breath and use the advantage of the heart, the chest wall moving away from the heart to move it out of the radiation beam. There's simple techniques such as just simulating the patient and taking their CT scan when they're holding their breath. Other ways where we have devices that can track the motion of the chest wall and turn on the radiation beam only when they're at deep inspiration, again, taking advantage of the fact that the heart moves away from the chest wall. There's various different techniques that have been used through the years, but again, all taking into consideration the unique aspect of the fact that the heart moves away from the chest wall and the breast, and timing the radiation therapy to the delivery of when the patient holds their breath, predominantly at deep inspiration. And this has allowed us to reduce through the years the heart dose to very insignificant levels and reducing the potential long-term toxicities of cardiac disease, etc. So again, breath hold, just a unique aspect of when we hold our breath, the heart moving away from the chest wall and the breast and timing the radiation delivery to that point in the breathing cycle.